And happening now, a new law overhauls Colorado's mental health response system.
It ends the practice of putting people in crisis in jail. Political specialist Sean Boyd is live at the Denver jail. Sean, this is significant.
Kathy, it is a $7.5 million effort to build a statewide crisis response system. When mental institutions closed decades ago, we essentially replaced them with jail cells. Colorado, now one of only 6 states that still jails people for no other reason than they're experiencing a mental health crisis. That's about to change.
Great. That's a law.
A law that decriminalizes mental illness, treating instead of jailing people in crisis.
Having mental illness is terrifying in itself, in your own brain.
Chrissy Hodges knows that terror and says being jailed for it only makes it worse.
So it's that added layer of shame that really does exacerbate the symptoms. It really makes you believe that you shouldn't be part of society.
I mean, this notion that people who have committed no crime, but they're going through a real mental health crisis, could be locked up for, 72 hours, sometimes even more, it's un-American.
Governor Hickenlooper fought to change it with the help of Representative Joe Salazar and Senator John Cook, a former sheriff.
Because the problem is in rural Colorado, they didn't have facilities like this, or they don't have facilities like this, and so the sheriff was put in a bad spot.
They carried a bill creating a crisis response system with more walk-in centers like this and mobile treatment teams in every part of the state.
It really does send a message to the rest of the state of Colorado that we are going to act in a humane and thoughtful way towards people who are having a mental health crisis.
Recovery is possible for anyone, and it starts with the people that they first encounter. If you show someone you believe that they can get better, then they have a good shot at being able to live in recovery.
To give you an idea of the need in rural Colorado especially, Grand Junction has 1 mental health facility with 20 beds for the entire western slope. In just the last 10 months, Department of Health and Human Services says 122,000 people sought help at the 11 existing crisis centers in Colorado. The money to implement the law will come from pot taxes. Live in Denver, Sean Boyd, CBS 4 News.
Sean, thanks. Back to